Great. Thank you so much. Moving on to the topic of rehabilitation. Dr. Narayan, when should someone begin rehabilitation? And do you recommend rehabilitation for all people diagnosed with TM or just those with paralysis?
The first question is very easy. The answer is very simple: as soon as possible. So I would say if somebody gets diagnosed with transverse myelitis, the very next day when the physical therapist is available, you should get the physical therapist see you for transverse myelitis. So this typically should happen when the patient is admitted in the hospital itself. If the patient did get admitted, it should happen in the hospital itself. You don't want to wait for the patient to be discharged and then later establish care with physical therapy. Physical therapy starts at the earliest possible time, number one. And there are studies to support that the earlier therapies begin and the more aggressive the therapy regimen is, the more appropriate it is. And when it is offered by the most appropriate kind of physical therapist, meaning a physical therapist that is particularly trained in this area or that understands this condition much better, the outcomes are much better. Okay, so that's number one. Number two, do you recommend physical therapy for all patients? First thing is, I would say by and large, yes. And the reason is, you do not need to have paralysis for you to get into a physical therapy regimen. Even if this was just a sensory impairment where you do not, where the patient may not have any weakness per se of the muscles in the legs, they just may have sensory symptoms like numbness or tingling, etc. I would still recommend a physical therapist to evaluate this patient because lack of sensation in the legs might mean lack of balance and a fall risk because of that. Number one. Number two, weakness is not the only symptom of transverse myelitis. As Dr. Chi clearly pointed out, there are so many other symptoms. For example, spasticity is another very important symptom in transverse myelitis where the legs can be stiff, and that can sometimes affect the mechanics of walking. So that is also another reason to see the physical therapist. So the answer is you do not need complete paralysis. And I would say every transverse myelitis patient should get evaluated by a physical therapist at least once. And then depending on what the physical therapist thinks and based on the assessment of the physical therapist, we could make a plan for the future.
Great. Thank you.